For patients with heart artery blockage, and that's why they are taking blood thinners, unfortunately, it's true that you will have to take this blood thinner lifelong. Two commonest blood thinners that we use nowadays will be aspirin or cardioprin, and the other one is a drug called clopidogrel, or the brand name is called Plavix. So we know that for a patient with a blockage of more than 50% in the artery, either the blockage or they have already a previous angioplasty and a stent or ring put inside, these patients by definition already have heart disease. We know that when they are on a blood thinner like aspirin, the risk of subsequent heart attack or stroke is lower than if they did not take the medicine. So of course they can stop the medication, they can choose to stop, but the scientific studies have proven that if they continue aspirin and Plavix, their risk of future heart attack or stroke is lower. So for that reason, we advise them to continue aspirin or one of the other blood thinners like clopidogrel lifelong. We also know that these blockages in the arteries are caused mainly by cholesterol deposits. We also know from scientific studies that the lower we bring the cholesterol, the less the deposits in the artery, and we also lower their risk of heart attacks and heart disease. So again, for somebody with already having heart disease, we ask them to take cholesterol medicines lifelong because we know that there's a benefit. So if a group of patients do not take the cholesterol, they actually have a higher chance of future heart attacks and heart disease than those who take. So unfortunately, a couple of the medicines like the blood thinners and cholesterol would be lifelong. For the other conditions that a patient may have, for example, high blood pressure, diabetes, then really it depends on the control. If, for example, they make really good lifestyle changes and they control their weight, their exercise, and their pressure is better, it may be possible to reduce the dose or stop the medication. And the same for diabetes. But my experience is that usually it is difficult to reverse it completely. And at best, we can try to reduce the dose of the drugs to control blood pressure and diabetes. But most likely, the patients will need some medications lifelong because we know that these medications will help reduce the chance of future heart attacks and strokes.